Healthy Living House Calls, sponsored by Florida Hospital, and we so appreciate it. Back pain. It's one of the most common reasons that people go to the doctor or maybe miss a day of work. A leading cause of disability, really worldwide. Most people, at one point or another, suffer from some kind of back pain at least once, right? Or more than that. So how can you take some measures to relieve or even prevent most of the back pain episodes? Joining us now is Dr. Chetan Patel, Medical Director of the Spine Health Institute at Florida Hospital. So exactly the guy we need to talk to. It happens, and as you get older, it can happen just turning around to pick something up. Oh, there goes my back. Oh, you're out.
Oh, yeah.
How do you prevent something like that from happening? Are there things that I can do to make sure that I don't, wrench my back?
Oh, absolutely. There are things that all of us honestly should be doing as we get older to protect our backs. And that would really boil down to 5 things that you can do. Okay, number 1 on my list is aerobic exercise. I know it doesn't make a lot of sense, but actually overall aerobic fitness really helps you. So, you can bike, you can jog, you can swim, walk in the water, whatever you want to do.
Yeah, like say, motion is lotion and rest is rust. So just keep going.
I love it. That's right. Number 2 is going to be core strengthening and flexibility. That's your back and abdominal muscles. And maintaining the flexibility in your spine.
Like planks and things like that?
Anything there's a lot of different ways to do it, but anything you want to do. Number 3 is going to be proper ways of bending, lifting, twisting, and that's what you were talking about. Right? So when you want to move over and grab something, look, I'm twisting here, grabbing something, or I can use my whole body to turn instead of my back. Right? So when I do that, I'm protecting my back.
Okay, good. That's 3.
Number 4 is going to be not smoking.
Oh, okay. So far, I'm gold. I'm doing all these things.
All right, number 5. Here's the hardest one for most of us. Staying within 10 pounds of your ideal body weight.
Now you lost me. No, I just kidding.
Me too. but that's really an important goal. So if you do all of those things, I think that the odds of having back pain are much lower than if you were to do either 1 or 2 or 3 of those things.
You can sometimes feel like your back is doing just fine, and then you make that one motion, and it's out. It's like your back is like, I'm hanging in there with you. You got to help me out, and then it says, I'm out of the game. That's it. Guess what? Now we hurt.
Yeah, so, once you do get hurt, I think you want to make sure that you take some anti-inflammatory medicines. So those would be the ibuprofen, Aleve, those types of medicines as opposed to Tylenol.
Oh, really? Okay.
Yeah. You may want to rest the initial 2 to 3 days and put some ice on your back. Ice on your back initially, followed by heat after you.
See, I was testing you. I was testing you. It was the ice. I've always heard that your legs are sort of attached. Anything with your legs, if you've got tight hamstrings, odds are eventually, and you try to do all the aerobic stuff, eventually you're going to have some back pain.
Absolutely. Your back and legs are connected, so you want to make sure you focus on both. So you want to have good stretching of your hamstrings. For example, you're talking about going out and running.
Yes.
Right? So that's a very important thing. First thing you ought to do is make sure your hamstrings are nicely stretched so you don't get back injuries. Right,
okay. Well, I ain't the most limber guy in the world, but I'll do the best I can for you. Chetan Patel, I appreciate you coming in so much. Now, he's not going anyway. Dr. Patel is going to be sticking around, answering any viewer questions you might have about some back pain maybe you're suffering from. If you've got something you want to ask, all you got to do is this. Go to our website, fox35orlando.com/health, and you'll find Dr. Patel. Just post your question. He'll try and answer it as best you can. And then we are going to come back with Dr. Patel maybe at the end of the 9 o'clock hour and see what folks have been asking, okay?
Great.
Are you ready?
I'm ready.
All right, go log on. All right, we're going to